Okay, today I want to talk about flexibility and the physiology that impacts flexibility, why it's important and a component of health and fitness, and then how we actually attain better flexibility, the methods that we use to achieve this, and a little bit about the physiology of what's happening when we become more flexible. Flexibility is impacted by a number of different facets. Firstly, joint structure. Okay, when we have our different joints around our body, they are structured differently from person to person. So one person may have, for example, a ball and socket at their hip or on their shoulder that is deeper than someone else. So if you have a shallow ball and socket joint, the ball is further away from the socket. Think of a golf ball and a golf tee, and so it can move easier. Now if you have a deeper socket, that is more restrictive than a shallow socket, and you can hopefully understand why that happens often in hip impingement with the squat. You may, if you have a narrow stance, may impinge as you flex at the hip. But it's also to do with age, how old you are. If you see a child, they are very flexible. A kid, you go through some assessments when they're born of just how easily their movements and joints occur. But as you get older, we get a little stiffer, movement becomes harder, and we actually get a process known as fibrosis occurring, where our end terminal junctions, where muscle connects to tendon, which connects to the bone, those become more fibrous. So the muscle becomes more like connective tissue than muscle, and that doesn't stretch as well. Also, your sex. Females on average are more flexible than males. So we get this difference between male and female. The amount of muscle mass that we have. The more muscle mass, as you can think, kind of similar to the joint structure, it can impinge, it can get in the way and therefore limit range of motion about the joints. Your activity level. People that are more active normally have better flexibility because they're putting their joints through more ranges of motion. If you have a sedentary person that doesn't move around much, the muscles become tightened in those positions and don't like to move out of those. That's where they're comfortable. Someone that's more active is likely to move around in different movement planes and therefore increase range of motion and flexibility about those joints. This is especially important as you get older. The more movement that you continue to do, the better your flexibility. Also, neural control. Are you even aware that you're tight, that you're contracting muscles? Are you able to relax them? Some of the difficulties that people face when they're trying to stretch is their muscles just won't relax. There's some techniques that we use to help with this. Lastly, pain tolerance. When we static stretch, we may be doing that at the point of discomfort. So dependent on your pain tolerance is how far you can actually push a muscle into a stretch before you basically hit your limit and say, I can't do much more. Okay, varying people have different pain tolerances and therefore can put their muscles under stress loads a little differently. So I want to explain the physiology behind the muscle and firstly, how muscles are aligned in a sacroiliac. We have these protein filaments that lay in series and parallel to each other that contract and stretch. Okay, contract, relax, contract, relax. And a powerful muscle, one that can contract forcefully, has to be pre-stretched. You probably apply this and you don't even realize it. If you were going to jump right now, stand up and jump. Prior to that, you probably did. You bent your knees and you pre-stretched your quadriceps and your ankles here, so your gastrocnemius got pre-stretched, so that when it contracts, it can contract more forcefully. Just like this elastic band, if it is a muscle, if we stretch it, it has a more forceful elastic potential. And our muscles act very similar, tendons even more so. Okay, so we can increase flexibility in a number of ways, and there's a few different types of stretching. First off, static stretching. This is normally done after workouts where we're at the end range of motion and putting enough stress to be at a point of discomfort. We want to get the body out of its comfort zone into discomfort so it will adapt. Okay, we can do this by increasing the end range of motion. I've just stretched my muscle. You can do it at the insertion, you can do it at the origin. There's also ballistic stretching, a bounce-like movement to increase the length of the tissue. Now this does work, but it is linked to high rates of injury. You really want to be specific to your training, so if your sport is explosive and exhibits movements like a bouncing movement, then pre-stretching that muscle and warming that muscle up in that type of way is productive. However, for the majority of people and the majority of sports, the majority of events, that isn't going to be the best procedure. Dynamic stretching. This is the full range of motion movement about a muscle. Just trying to increase and warm up a joint and put the muscle through full range of motion. Getting it to stretch fully, getting it to contract fully. Getting blood flow all the way through and warming it up. This is normally done prior to workouts or competition. You also have proprioceptive neuromuscular facilitation, or PNF for short. And this is using the proprioceptors in the muscle. So we have organs known as GTOs, Golgi tendon organs, that are located in the terminal ends of our muscles, near the tendons. They detect tension that's being put on the muscle. And when too much tension is suddenly put on the muscle, they down-regulate and they relax the muscle so that it doesn't contract against it and strain. This is a three-component process that allows you to stretch and actually decrease tension in a muscle. This is great for older adults and athletes that don't even understand that they're tight and they can't relax it, they don't know how to relax it. We can use some of these techniques to elicit a response from our proprioceptors and to downregulate muscle activity. The first component, hold, relax. This uses a passive pre-stretch and then a isometric contraction of that stretched muscle, causing autogenic inhibition and a decreased tension in that muscle fiber. Following, you passively stretch the muscle with greater range of motion. The second component is contract relax. It again starts with a passive pre-stretch, then a concentric full range of motion muscle contraction against a resistive force. This uses again autogenic inhibition to downregulate activity and relax the muscle, causing a stretch to occur. The third component uses the hold relax with an additional agonist contraction. This not only uses the autogenic inhibition that we've mentioned earlier, but also reciprocal inhibition. We passively pre-stretch the muscle, we have isometric contraction of the stretched muscle, and then a concentric contraction of the opposing muscle. Now think about that. When you contract any muscle and create a movement at a joint, the opposite muscle must relax in order to allow that to occur. If I contract my bicep, I get flexion at the elbow, but to allow that, my extensor, my tricep, has to relax. If my tricep contracts and I extend at the elbow, my bicep has to relax to allow it. So when we upregulate activity to one, we downregulate activity to the other. This is a force coupling relationship. So there you have it. Hopefully you have a better understanding of how muscles gain flexibility and the physiology behind some of the techniques that we can use. Don't forget to like my video, comment below, share this content, and enjoy.